Good afternoon. I'm Adhir Shroff, Associate Professor of Cardiology and Cath Lab Director at the University of Illinois at Chicago, and I'm pleased to be joined by Dr. Sunil Rao, Associate Professor of Medicine at Duke University School of Medicine. We are happy to introduce you to Transition for Value, SCAI's new comprehensive quality improvement initiative focused on maximizing the value of PCI within the context of value-based healthcare by increasing the adoption of transradial PCI. We greatly appreciate the support of Medtronic for supporting this initiative.
So what is SCAI Transition for Value? It's an 8-part toolkit with modules designed for those new to transradial access, as well as those trying to take an established transradial program to the next level. All the modules will be housed on transitionforvalue.com, and we'll be continually adding webcasts to explain how to employ these modules at your cath lab. We'll also have other tips and tricks focusing on how to demonstrate the value of transradial PCI to key stakeholders. One of these tools is the Transition for Value scorecard, which provides several potential methods to measure the value of transradial PCI and allows you to set goals for your facility.
So, who is this program designed for? Well, the answer is simple. It's designed for interventional and invasive cardiologists, as well as cath lab and cardiovascular service line administrators along the full spectrum of transradial practice from beginner to advanced users. For interventional cardiologists who are new to transradial access or only perform a small percentage of cases using transradial access, the toolkit will focus on education around the benefits of transradial access from a patient selection, clinical, and economic outcomes perspective. For interventionalists who have already adopted transradial access, the toolkit will help you determine roadblocks to greater TR transradial usage and overcome barriers to increase adoption in more complex cases. For cath lab and cardiovascular service line administrators who oversee labs with limited TR transradial adoption, the toolkit will focus on how they can make a case and get greater buy-in for greater use of transradial adoption by going through the basics to show how transradial access utilization can improve clinical and economic outcomes, enhance lab efficiency, and increase patient satisfaction metrics. For those labs that have already adopted transradial access, the curriculum will feature advanced content to also showcase how increased transradial access cases can enhance cath lab efficiency and increase patient satisfaction metrics. This focuses in on value-based healthcare, bundle payments, and how transradial access can pave the road to success.
This is what the Transition for Value tool will look like. It's an 8-part modular set of slide decks on a variety of topics. The first topic is really an overview of value-based healthcare and how radial access can fit into that paradigm. The second module reviews the clinical benefits of transradial access, focused on the randomized trials and observational data. The third module focuses on the economic benefits of transradial access and the economic argument for adopting radial approach. The fourth module is Femoral to Radial 101, how you can start to adopt radial access, what are the initial cases that you should choose, and then how do you scale up your radial access to the highest risk cases. The fifth module is based on best practices, tips and tricks for radial access technique based on the best practices consensus statement from the SCAI Vascular Access Working Group. The sixth module is Rethinking Care Delivery in a Radial Approach Cath Lab, which is really focused on facilitating efficient patient recovery. The seventh module is directed at cath lab staff and what role they play in a high-volume radial program. And then the eighth module is how you can initiate change and convince your partners as well as your cath lab to adopt a radial-first approach to their cases.
The exciting part about the Transradial for Value or Transition for Value toolkit is that we'll have a dedicated web presence for this initiative at transitionforvalue.com, where users can, one, download the Transition for Value toolkit of the 8 modules, access a webcast series focusing on how to employ the modules. This series will feature new additions as we progress through this initiative. Then we'll be able to measure success by entering their transradial access information and setting their own 12-month goals based on their facility's needs, and then learn about other educational opportunities.
So now that we've provided you with an overview of the Transition for Value toolkit, let's dive into the first module. Dr. Shroff's going to present to you on how value-based healthcare affects your clinical practice.
So how value-based healthcare affects your practice. So as you can see, value-based purchasing has become a very important aspect of the way we provide care, as you can see on this cms.gov website. What is quality? Well, quality has been defined by the Institutes of Medicine as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Really, what is value? It's a very important concept, and really really boils down to healthcare outcomes per dollar spent. In terms of performance measures, this is something that we've increasingly is becoming increasingly important in healthcare delivery, and it represents a meaningful outcome to patients as well as to society in general. These measures need to be valid, reliable, and readily measured. They have to have this ability to be adjusted for patient variability. They need to be modifiable through improvements in care processes, and they have to be practical to measure. So, for example, here are some of the common ACC CAP-PCI performance measures. Usually these performance measures are used internally for quality improvement, and they include risk-adjusted PCI in hospital mortality for all patients, for STEMI patients specifically, as well as for non-STEMI patients. People also look at risk-adjusted PCI-related bleeding, risk-adjusted post-PCI acute kidney injury, as well as risk-adjusted 30-day readmission after PCI. And what you can see from this figure that was published in 2016 in JACC Interventions is the use of bleeding avoidance strategies as a hospital performance measure. And what you can see is for institutions that adopt bleeding avoidance strategies at the 80% or higher level can see significant benefits in terms of having a decrease in their bleeding complications. And this is based on 2.4 million PCI patients from the CAP-PCI registry. And so thinking about hospitalization and another opportunity to improve value by incorporating same-day discharge into your PCI algorithm, patients who are hospitalized, there are risks of being in the hospital, including medication errors, delirium, falls, hospital-acquired infections, and difficulty for education of your patients. And what you can see here is, interestingly, over the past several years, there has been an increase in same-day discharge as we have all begun to appreciate the risk of prolonged hospitalizations in patients and whether truly keeping patients in the hospital for longer periods of time really is necessary. And so in terms of value-based healthcare, what we're talking about is value in healthcare as an expectation by patients, payers, as well as regulators. The quality of care is an integral part of value, and bleeding complication is one example of quality that can be measured or considered as a PCI performance measure. Adoption of safe, effective, and efficient PCI strategies can also achieve value, and these are where radial approach fits in very nicely, as well as same-day discharge in appropriately selected patients. The Transition for Value program is designed to facilitate value-based care. Thank you.